Hello and welcome to the Keep It Real Health Education series. In this episode, we're going to be talking about preventing the fall and what to do after the fall. My name is Dale Collins and I'll be your host. I'm an exercise physiologist, strength coach, writer, speaker, and researcher with over 2 decades of experience in the fitness industry. I have a master's degree in exercise physiology and biochemistry, and I'm currently a doctoral candidate in health and human performance. Balance is your body's ability to remain upright and keep its center of mass over your feet. In other words, balance is your ability not to fall. And this becomes very important with age. One of the big things is with balance, if you don't use it, you lose it. And most people don't try to be off balance, which means they never really challenge that ability to maintain their balance. Now, in certain movement exercises and in sports, balance is very important and we utilize it a lot. But training balance with age becomes a huge issue because once there's a fall, if someone falls and breaks a hip, 50% of those individuals pass away within less than a year. So maintaining that balance and being able to react quickly is very important. Your body uses three major systems to maintain your balance. This is your vestibular, your visual, and your somatosensory, or your proprioceptive, or what we would call muscular system. So vestibular is your inner ear. If you've ever had problems with your ears, if you've ever had water, or if you've ever had any type of virus within your ear, it can affect your balance. Now, your vision, this is about 30% of your balance, being able to actually see, are you upright? Are you leaning one direction or the other? This is 30% of the input to know whether you're actually maintaining your balance. And then proprioceptive muscular, meaning your muscles actually contracting or tightening to help maintain your balance or keep you upright. So exercises that actually work on your balance are only one type of exercise, meaning the other types are strength, endurance, and flexibility. And all of these can actually work to improve your balance. So for instance, strength training, especially in the legs, hips, and glutes, can improve your balance. Yoga for flexibility, a lot of the poses, some of them are single leg, can also work on your balance. So balance is one part of exercise. It's not necessarily something you need to do every day, but it's something you need to work on at least once or twice a week. If you don't have good balance, maybe 3 to 4 times a week, or choosing exercises that are going to perform strength training and or flexibility and also work on that balance component. So ideally, balance is important for a lot of everyday activities, walking, going up and down stairs, carrying your groceries, but this is something that really helps to prevent falls, is having good balance. So when we talk about specific components of balance, muscle weakness is one of the biggest issues. If you don't have the strength actually in the muscle itself, even if it contracts because you lose your balance, it may not have the physical ability to keep you from falling. So that strength within the muscle becomes very important, combined with how stiff your joints are. Meaning, if your joints are really stiff, if you don't have good flexibility, it actually hinders the strength of the muscle to help you maintain your balance, or you start to become off balance. That joint stiffness is going to kind of throw you in a specific direction that maybe you normally would not go into if you had the mobility within that joint. Now, we already talked about inner ear, certain medications, things for depression and high blood pressure, lack of balance can be a side effect. But one of the other biggest components is literally a lack of activity or a sedentary lifestyle. Once again, not doing enough physical activity to work on balance, getting out and walking, going up and down stairs, all of these things, while they don't seem like a big deal, they do challenge your balance a little bit every day and work on improving or at least maintaining your sense of balance. Now, when we dig a little deeper, there are specific muscle groups that are going to have a bigger role in your balance. Obviously, your core. This is huge because it connects your upper body to your lower body. So it's not just your abs, it's all the way around, including your lower back. So all of that musculature, if your upper body starts to move one direction, your core is very weak, can't stabilize. Now you've got weight and momentum going one direction that your lower body needs to control. That's why your legs are important. This is the key player, basically starting with maintaining your balance. If your feet move, if you start to slip, if one leg starts to slide, you've got to have that leg strength to really be able to contract to stabilize you. After that, it's your glutes. So your glutes stabilize your hips. If you can't stabilize your hips, that becomes a big problem because you can't do any single leg work. And usually when we start to become off balance, it's one leg that slides. If we can't tighten up our hips, stabilize our glutes, the other legs go in too. And then your back, your lower back, and even to a point your upper back all rely on being strong to help you maintain your balance. Once again, your back stabilizes your spine. If that spine starts to go, it changes your momentum. It makes it so your center of gravity is not over your hips or your feet anymore. That's when you're going to lose balance. So these four major muscle groups are the big areas that we look at for strength training to help improve your balance. So what should you do? So balance is what we call a motor skill, meaning it can be improved, but also if you're not using it or training it or even maintaining it, you lose the ability to right your body and stay balanced. So first thing is this needs to be in a controlled environment. You need something close by that you can grab a hold of while you're performing balance exercises if you really start to feel yourself off balance too much. We want a little bit of imbalance because that's how we work those systems, but within reason. We want to do this safely. If balance exercises are easy, then we do little things like either make what you're standing on move a little bit more, or even something as simple as closing your eyes. Once again, that takes away 30% of your visual acuity. It forces your muscles to actually send signals to your brain as far as what's going on. Are they starting to move one direction? Is it tightening up? Are your hips staying stable? That's that proprioception piece. So it really gives a lot of respect to people who do not have the ability to see. They're walking around, they're doing all these things, they're moving without 30% of their balance, and they're doing a great job. So closing your eyes is one way. It's not the first way that we usually train people. First way is simply single leg exercises. And as we've mentioned before, you have fast twitch versus slow twitch muscle fibers. So a lot of times, simply doing a little bit of strength training, doing a little bit of balance work, we will see how quickly you react really change. Your body will learn to react faster simply for the fact that you're actually working or training these fast twitch muscle fibers that do as they state. They move quickly once they're innervated, once they're given a signal. So balance training, strength training, power training, all of these things specifically work those fast twitch muscles that you need to maintain your balance. When we look at testing your balance, meaning do you have good balance? First thing we need to do is test it. We need to see, can you perform some of these tests within normal ranges to determine how good is your balance or not, how bad is your balance. So this is the first one, feet side by side. You're basically standing right there. You should be able to stand this way for 15 seconds. Don't lock your knees without needing any assistance and keeping your eyes open. If that test was easy, now we change the feet so the instep of one foot is touching the big toe of the other. So they're almost overlapping. We've kind of narrowed the feet in a little bit. We've narrowed your base of support, and you should be able to hold this for at least 10 seconds without needing any support, still keeping your eyes open. Obviously, we want to try each side independently to see if there's any difference right side to left side. Now we line up the feet, meaning putting you heel to toe. In this case, you notice they're starting off with the right foot in front, left foot behind, making sure that you can keep everything lined up well, and then holding this position for 10 seconds without needing assistance and making sure you keep your eyes open. Then, of course, we would switch, put the left foot in front, try it again. Can you hold it for 10 seconds? Is there a big difference in how long you can hold it from left side to right side? And then the last test is actually standing on one foot. So in this one, you want to stand on one foot only. You can either bend at the knee at the other leg to pick the foot up, or simply lift the leg up, straight up. And ideally, you should be able to do this for at least 10 seconds without wobbling, without needing any assistance, without holding on to anything, and keeping your eyes open. Obviously, the longer you can hold it, the better, but 10 seconds is a minimum. And you want to do both legs again. We want to look at any imbalances, one leg to the other. If you've had a prior injury, we may see that one leg doesn't have the strength or the balance of the other one. This is the point where we want to take note of those things so that we can work on them when we start performing exercises. So one of the most basic exercises is called a glute bridge. And this one, a glute bridge, is a great exercise for so many things. It works your core, it works your lower back, it works your hips and glutes, it works your hamstrings. And you can do this from the floor. If you have trouble getting up and down off the floor, then do this on your bed. And start by really squeezing those glutes, picking the hips up so your body is straight from your shoulders to your knees. You don't need to hyperextend and go further than that. Come back down. Ideally, don't let your butt touch the ground, or just barely touching back up. If that's too much, you can come all the way down, let your butt touch the ground, pause, rest it for a second, then come back up. So this is a great exercise to work on building that glute strength, hamstring, and lower back. We call that the posterior chain, and it all works together. So very important exercise for your balance, for your core as well. The plank exercise is another great way to work on strengthening your core, your hips and glutes, and your legs. So in this case, if you have trouble holding this position, one thing that we do to regress the exercise is actually place your elbows on a higher surface. For instance, a kitchen counter or even a wall. What that's going to do is that's going to decrease the amount of body weight against those muscles, allow you to work on getting stronger before slowly dropping the upper body down to a lower surface. And in this case, you're going to hold a plank for time. Ideally, you should be able to hold a plank for 2 minutes at a minimum, all the way up to the age of 65. So if you can't hold a plank for that long now, usually we recommend starting with 4 individual planks, anywhere from 15 to 30 seconds, slowly work on increasing time. The last core base exercise is going to be a Superman. So in this instance, you're laying flat on your stomach, and this can be done on a bed as well, working on trying to keep the head and neck in a neutral position. You're picking up both arms, both legs at the same time, up and then back down. So this is going to be repetitions. You're not trying to hold them up for a length of time. You just simply pick them up together, back down together. At this point, don't worry about how far you're going. If you have any lower back discomfort or upper back, shoulder, neck discomfort, try to pick it up only an inch or two off the ground. You don't need to go nearly as high as what's shown in the pictures. It's just simply picking those areas up, bringing them back down. So this is going to work hips and glutes, hamstrings, lower back, but now we're starting to get at some of that upper back and shoulders and mid back involved in the strength training. This is how we work on balancing on a single leg. We start off with the feet slightly apart. You can either have your hands placed on your hips, or if you need to, have one hand placed on a chair or other solid, stable place beside you to make sure that you've got support. And you slowly want to pick up one leg, hold it, and ideally you want to try to hold it for 10 to 15 seconds. Obviously, the longer the better. Then bring it back down and touch. And you can alternate sides, or if you want to be a little bit more challenging, do sets of 10 to 15 on one leg before switching to a set of 10 to 15 on the other. If you can't pick it up to 90 degrees at the knee, just try to pick the foot up off the ground just a little bit so that you're standing on the one leg. And the leg that you're standing on, do not lock the knee. Once you lock the knee, you actually lose some of that muscle control. You want to keep the knee just slightly bent while you're performing this exercise. Another great exercise that's going to actually really work on whole body, but more specifically lower body, your core, your glutes, your legs. This is going to be squats. Now, when we perform squats, I usually like to have people start off doing these off a chair. This does two things. Number one, it makes sure you don't go too low. Second thing it does, it actually helps improve and make sure that you're using proper form. A lot of people start off with squats by bending their knees first, which forces their knees to go over their toes. You actually want to start the squat on the way back down by pushing your hips backwards like you're trying to put your butt down on a chair behind you. This reinforces proper form, and in this case, it gives you a slight break in between. So making sure you're performing this, obviously off a chair that does not slide backwards. Performing this exercise 3 sets of 8 to 10 is going to be a great way to work on strengthening those legs. The seated leg extension is going to focus a lot more on one specific muscle group, which is going to be your quads or the front of your legs. So you're going to do this seated off a chair, extending one leg out, and we want full extension. Try to lock that knee at the top, relax the knee, bend it back down. So you want to complete, ideally, 10 to 15 reps on each leg with 2 to 3 sets. This is a great way to work on those quads, which is one of the major muscles you need to stand, walk, move, and maintain your balance. And then the last exercise is a calf raise. So literally coming up on the balls of your feet, heels off the ground, hold it for about 2 seconds, back down to starting position. I'll usually have somebody hold on to a chair for balance or a wall or any solid object, kitchen counter, to make sure you're not going to fall. Your calves are one of the other pieces of musculature that really work on maintaining your balance by really positioning that ankle. So tightening up, helping stabilize your ankle can also be a big part of your balance. Working once again, 3 sets of 10 to 15 repetitions is going to work that muscle. Now, what happens if there is a fall? Initially, this is going to seem counterintuitive, but we don't want you to try to pick the other person up. Your first reaction is going to be try to help the other person up, and the issue with this becomes they're actually going to more than likely pull you down on the floor too. If you're trying to pick them up, and especially if you don't have the strength, you're literally trying to move their full weight, and their weight is going to pull you to the ground. It's going to put you off balance. It's going to increase your risk of an injury. The correct way to help somebody if they have fallen is place a chair or stool next to them. That's going to allow them to actually use that to help pick themselves up off the ground without pulling you down. You want to try to get them up off the ground if there's not a major injury. If there is a major injury, obviously you want to call 911 if they think they've broken their hip or broken anything else. If they have not, they're not bleeding, they haven't broken anything, then put something next to them that they can use to help get themselves up off the ground. You can aid, but you do not want to actually try to take their full weight. So a chair or stool is going to be something stable where they're going to be using some of their strength and weight to offset picking themselves up, and you can assist a little bit in that. Then you want to check for injuries. Ideally, what we want, if there's any type of swelling, we want ice. The first 24 to 48 hours, we want to reduce the swelling. We don't want heat. Heat will actually pull more fluid into the area. And believe it or not, if you actually use heat on an area that's still swelling, you can cause damage by pulling excess fluid in, putting pressure on the tendons and ligaments. If they don't have swelling, especially across the joints, that's where we're most likely to see it, but they feel pain in the muscles themselves you can use heat on to help relax and release the muscle, and then gently stretching. You don't want to start doing balance exercises until there's no pain. So if they're still in pain, no, we're not going to do any of the balance exercises. We need to get them out of pain first before we start the strength training. Your balance is very important long term. As we stated earlier, 50% of the people that fall and break a hip pass away within less than a year. Maintaining your balance is a huge issue as we age. It really decreases that risk of injury, keeps you mobile, keeps you able to go out and do the things you want to do, the things you love to do. So how do we maintain that? First thing is going to be balance training, working on doing things single leg, working on placing yourself slightly off balance, making sure you have good strength. Strength training is going to help your balance. It's going to help those fast twitch muscles and make sure that when you need them, they are there for you. So ideally, at least once to twice a week, we do want to do some type of balance training. If you find that you are having trouble on any of those balance tests, you may need to do more than once or twice a week until you can start seeing some improvement. Making sure your posture is good. This is also going to make sure your body weight is distributed correctly over your hips, over your feet. So all of these things are going to go a long way towards improving your overall balance, reducing your risk of a fall. And once again, if somebody does fall, do not try to directly pick them up. One of the things we say in emergency medicine is scene safety. If that scene is not safe, if you go in, rush in too quickly, you become the next victim. They'll pull you down, not intentionally, but simply because you may not have the strength to lift their full body weight from the ground. So find something, a chair, a bench, a stool, something solid and stable you could put next to them to allow them to work on getting up, and then you can assist them.